Welcome to the deep dive.
Okay, so today we're digging into something called the clawback mechanism in Greece.
Boy.
And specifically how it's really hitting physiotherapists there. We've got some interesting sources, analysis, stats.
Yeah, the goal is really to unpack this, understand what this financial tool is, and what it actually means for people on the ground.
Exactly. So just to start, what is this clawback?
Well, fundamentally, it's an austerity measure from the post-2010 period.
Yeah.
Basically, if Greece's public health spending goes over a preset budget,
Okay.
then healthcare providers, and that includes pharma companies, diagnostic centers, and crucially for our chat, physiotherapists, they have to pay back the difference to the government.
Pay back money they already earned.
Essentially, yes. For physios, this started July 2013, but the kicker was it applied retroactively from January 1st that year.
Wow. Okay. So a surprise bill for the first half of the year. And this involves EOPYY, right? The main health insurance body. That's right. EOPYY handles the payments. The system uses these closed budgets. If the total amount EOPYY pays out for physiotherapy in a period, say 6 months, exceeds the budget allocated.
Then the physios have to cough it up?
Pretty much. The excess, the overspend, gets calculated, and then it's clawed back from all the providers proportionally. And they usually have just a month to pay it back.
A month. That sounds incredibly tight.
It is. And if you're late, you risk losing your contract with EOPYY, which for many is their main source of patients.
So it's this constant financial pressure cooker. What's the actual economic hit look like?
Well, research points to a lot of dissatisfaction. Physios often feel, that their pay just doesn't line up with the work they do.
I can imagine.
And here's a really worrying part from the sources many report having to ask patients for unofficial payments, sort of under the table.
To make up for the clawback losses.
Exactly, just to make ends meet, which of course raises huge questions about equity and access to care for patients.
Yeah, definitely. Is there a specific example of how this works out financially?
There's a pretty stark one from March 2024, highlighted by the World Physiotherapy European region. A physio billed EOPYY for 260 sessions, amounting to nearly 3,500 euros.
Okay, sounds reasonable.
But after the standard rebate and then the clawback deduction, they actually received just 1,847 euros.
Wait, so less than 2,000?
Yeah. It works out to about 7 euros and 10 cents per session, net.
7 euros? How can anyone run a practice on that?
That's the word they used. Unsustainable. And adding to the pain, sometimes EOPYY takes years to finalize and settle these clawback amounts.
Years. So the uncertainty just drags on.
Exactly. Which obviously makes financial planning almost impossible.
And you have to wonder, what does this do to the quality of care if you're constantly stressed about money, potentially not earning a fair wage?
It's bound to have an effect, right? Reduce motivation, maybe cutting corners, although professionals try not to. And it could definitely discourage younger people from even entering physiotherapy, a brain drain, potentially.
Let's look at the bigger picture numbers. This isn't just physios, right?
Oh, no. It's massive across the system. For pharmaceutical companies, get this, over 14 billion euros were clawed back between 2012 and 2022.
14 billion.
Yes. And in 2022, the amount pharma companies paid back actually exceeded what the state contributed to their costs by at least 200 million euros.
So the companies paid more back than the state paid out? How does that even work?
It shows how heavily the system relies on this mechanism for budget control. It gets even wilder. First half of 2023, for hospital drugs over 30 euros, the clawback hit 83%.
83.
Meaning the state essentially covered less than 2 out of every 10 treatments for some serious chronic conditions. The rest was funded through clawback.
That's staggering. Okay, back to physiotherapy specifically. What were the rates there?
For 2023, total physio spending was around 94 million euros. The clawback rate was 15.2%. A bit down from 15.6% in 2022, but still, significant.
15% of earnings just gone. And that March 2024 example we talked about?
That specific month, the clawback applied to physios was 24% of what they invoiced.
24%. So combined with the rebate.
Right. Going back to that case study, the total deduction rebate plus clawback was around 47% of the original invoiced amount. Almost half.
Wow. No wonder they're dissatisfied. Was there survey data on that?
Yeah, a 2024 survey found 84% of physiotherapists feel their pay doesn't match their work, huge majority feeling undervalued.
Leads to low job satisfaction, I assume.
Absolutely. And that same survey found 58%, over half, admitted to asking patients for those unofficial payments we mentioned earlier.
It paints a pretty bleak picture. Are there any proposed ways out of this? Solutions being discussed?
The sources do mention several ideas, things like, well, obviously increasing the overall health budget,
Makes sense.
setting some kind of cap on the clawback percentage so it doesn't just spiral, maybe exempting certain things like vaccines or services for the uninsured, linking clawback obligations to, say, investments in research and development, perhaps more for the pharma side, implementing wider structural reforms to tackle inefficiencies.
So not just relying on clawback to paper over cracks.
Exactly. And fostering, actual dialogue between the government, EOPYY, and the providers themselves. Collaboration.
Right. It sounds like a multi-pronged approach is needed.
Definitely. Relying so heavily on clawback just seems, well, unsustainable, as we said. It's squeezing providers to a breaking point.
So wrapping this up then, our dive today really shows how this clawback mechanism, while maybe intended to keep budgets in check, is putting immense pressure on physiotherapists in Greece.
Yeah, it's threatening their livelihoods, their ability to run a practice, and that inevitably raises concerns about patient care down the line.
It just feels like a system under extreme financial stress, pushing that stress onto the providers.
It does, and that brings us to the final thought for you, the listener. When a healthcare system relies so heavily on clawing back funds from its providers, what does that mean for the future? What are the long-term consequences for attracting and keeping essential professionals like physiotherapists, and ultimately for ensuring everyone can get quality healthcare when they need it? Is this really a viable way to fund healthcare going forward? Something to think about.